Nobody likes to use the word permanent. There's no way of testing for that. You'd have to know the exact moment of an individual's death and know exactly how to see all of these changes. And like right before they die, cut them open and look at it and see it and then be able to measure that it's in fact there at the time of death in order to make a really good argument for permanent. But we use the word chronic. Chronic is going to mean ongoing. We use the word chronic when we're describing this particular neurological disorder because that's the terminology that most people are comfortable with. In the case of hypertension, we don't say permanent because, maybe something's going to happen in some instance that, their heart's going to revert back to some way that it was at some earlier time. And, but everybody kind of knows that, at some point, we're talking about something rather permanent. In the case of type 2 diabetes, we're talking about, this is another chronic condition, and it's not like, oh, you're just going to start making insulin right again and, being able to manage your own blood sugar without any kind of other dietary changes or anything else. No, these are arguably permanent changes to the pancreas, to the heart, and other associated structures. And in the name of addiction, these structures are changed too. It's arguably permanent, but at least we'll just go with chronic. I'm using these other disorders on purpose because they tend to take place at similar rates in our society. Hypertension, type 2 diabetes. And they also seem to have similar relapse rates, and I'll come back to that in a minute. And they're similar chronic conditions that not everybody gets, but some people do. And the other thing that's interesting about these particular disorders is that they're permanent but treatable, and they have multiple components in their formation, that there's a biological component. Not everybody can get hypertension. Like some people could try really hard and they're just not going to get it. Not everybody's going to get type 2 diabetes. Some people, you could try, work on it, but like some people, it's just not going to happen. You could eat Cinnabon all day and nothing else, and you might, with the right genes, it might not happen to you. And it's this convergence of multiple factors, usually biological, genetic, if you will, and environmental factors that coalesce together in different degrees. Sometimes it's more environmental and sometimes it's more genetic, but it's this convergence of these factors that kind of develop into these long-term chronic disorders that need to be managed like all chronic disorders do. There isn't a cure. We're not going to wrap this one up this week. It's going to be like we're going to deal with the acute problem because there's always a crisis that usually gets the individual looking at any one of these or other similar disorders. There's always a crisis, and there's always an acute treatment that's done around it to kind of stabilize the individual and kind of give them a fighting shot at life because something's definitely wrong. But after that initial period of treatment, of kind of dealing with the crisis at hand, there has to be some sort of a plan of how the individual is going to manage their disorder from then on. And addiction isn't any different than any of these other disorders. It needs to be managed over time because, there isn't really a cure for it. And whether it's lifelong or not, that is adaptive to look at it that way in this particular disorder, and more so than others, because remember, the ability to distort reality is probably the number one symptom that we're going to be observing in addiction, because all other behaviors essentially are, I don't have the ability to override this impulse, I act on the impulse, and then I have to distort reality in order to make sense out of it. Maybe you guys have been seeing something that looks like that. That ability to distort reality doesn't go away. The neuroadaptive changes, and what I call the crowning jewel, the ability to distort reality in addiction, it doesn't go away. It can occur later on, and let's look at all it takes to get that to occur. Absence of treatment would probably be, and I'll talk later on about why that might be important, but absence of treatment would be one thing. And some sort of a cue. that initiates this drive, like hungry, etc. The drive state initiated. And if the individual sits with that drive state initiated and allows it to fester, interestingly, they begin to get reward before actually using the substance. In some cases, the reward from actually using won't be as great as the anticipation of it, ironically. But with enough of that, they're going to be impaired in their ability to weigh out the consequences and then have the ability to distort the reality enough to go back to something that has caused them extreme negative consequences in their lives. And usually the path of distortion after a period of abstinence and return to use in an individual will follow one of two paths. One of them is the I might as well just do this because it's hopeless, kind of the F-it syndrome, if you will. And the other one is going to be somehow different. As long as nobody knows, it doesn't count. Or I know I can change to doing this other way of doing it, and as long as it's a different substance, a different way, on whatever fantasy rule that you come up with, that's going to do it. The unfortunate reality is once this happens, we're reinitiating that drive. There's going to be further impairment, the ability to distort reality. And it's interesting because the person is able to take on that persona very quickly because it's all in place. This is why you might notice that after significant periods of abstinence, when an individual begins using, they start to change so fast. Like who they are actually starts to change rapidly. This is a chronic disorder, and relapse looks challenging, and that being able to distort reality even down the road is available. So we're going to want to include long-term treatment that somehow has some measure included in it that's going to prevent that from happening. I can't do acute treatment for a chronic disorder and expect long-term results. I wouldn't do it with diabetes. I wouldn't do it with hypertension, and it's probably not best in most cases to do it in addiction too. And it's really important to understand this ability to distort reality in order to facilitate that drive that I don't even know was initiated in some cases.